This short video is to introduce you to the RingwithSupport type pessary and talk about removal, cleaning, and reinsertion. The objectives of this video are to walk you through the removal process, cleaning, and reinserting the ring pessary with support, and to help you understand the potential complications that could arise with this type of pessary and how to prevent or manage them. So with any new type of procedure, the technique of dealing with pessaries, removing them and reinserting them, is something you master over time, and every patient's pessary is slightly different. Keeping the patient comfortable is one of the most important things that you want to ensure before, during, and after the pessary change. Verbally preparing the patient and explaining what you're going to be doing so the patient knows in advance and during the process what to expect and what is happening. Working slowly and carefully and observing the patient for any signs of discomfort is important. Making sure that you lubricate the introducing portion of the pessary with water-soluble lubricant so that it slides in easily is another tip. The RingwithSupport pessary is similar to the ring, but it has a floor in it, or a diaphragm. And this provides more support for larger types of cystoceles. It also means it's a little more difficult to insert and remove, only because it's a little trickier to get your fingers on it. To remove this pessary, you will notice that there is a larger hole at the front of the pessary, and hopefully you'll be able to insert your finger into that, reaching from above the pessary, pulling it down, and then pulling it towards you and turning it on its side to remove it out slowly. So when we remove the pessary, you will notice that it will have some discharge on it, hopefully no signs of bleeding, but there is a bit of a debris that can build up depending on each individual patient. And so we want to make sure we wash it really well with mild soap and water. You can do this either in a container that's large enough to submerge the device in, like a sterile basin, or you can take it to the sink and wash it with soap and water there, and just ensure that you really are able to soak off anything that's on it and be able to scrub around the edges if there's any debris that you feel needs to be removed. Once you've scrubbed it off and removed all the visible residue, then you rinse it under tap water for about 30 seconds and then dry it, and it's ready to be reinserted. The RingwithSupport pessary is folded in half to be reinserted, and it folds in half fairly easily if you fold it in half at the larger holes on either side. When you have it into the folded position, you want to ensure that you've first lubricated the end of the pessary that's going into the vagina first, and that will help to lubricate the rest of it as you slide it through into the vagina. You want to make sure that you have it firmly grasped in the hand with which you will use the inserting, and that you have the other hand free to be able to provide some pressure to ensure that you can slide on the vaginal tissue, to ensure you can slide this in towards the tailbone. It's important that you try to hang on to this pessary as long as you can as you're doing the insertion process, as it does tend to snap if you open it too quickly, and that can be very uncomfortable for the patient. Once you have ensured that it is far enough into the vagina, then you want to push it down as far as you can to the back, and then ensure that it pops up in the front. And again, put your finger into one of the holes and turn it a quarter turn to the left or the right, which will help to lock it in position. Most vaginal pessaries are relatively simple to manage, and we don't get a lot of complications with them. But I did want to take a few minutes to talk about some of the things that can occur and give you some sense of how to manage them. Pessaries in general are changed every 2 to 4 months, depending on the individual patient. So vaginal discharge, bleeding if it's related to erosions or ulcerations, and bowel dysfunction are the most common complications that we see. Vaginal discharge is probably the most common thing we see, and a lot of it depends on whether or not a patient is using some vaginal cream, such as Premarin, for support of the vaginal tissue. It is a pretty normal response to having a pessary in place, and the vaginal discharge should usually be a creamy yellow, greenish in color. It can also be a bit thick and creamy in texture. I do notice that it tends to occur more towards the date when the pessary is due to be changed, and it may be that you just need to increase the frequency of the changing of the vaginal pessary. So for example, women who choose to have their pessaries changed every 3 to 4 months and are complaining of this kind of discharge, I might be tempted to move them up to 2 to 3 months to see if that has an impact on the discharge. I would only consider swabbing the discharge in case there was any type of vaginal infection, if there was a foul odor to it, or if the patient had any redness and irritation that was visible, or if they were describing any type of itch. Quite commonly, what I would do is take the pessary out and leave it out for a few days and give them a break from it, let the discharge clear up, and then reinsert the pessary, and usually there's no further issues with it. It can also be related to the use of their vaginal estrogen or Vagifem, which they may be using. And if you may want to reduce or increase the amount that they're using depending on the amount of discharge. I also find that moisturizing gels such as Replens or Gynotrof are helpful in reducing discharge. So vaginal bleeding can be a sign of some type of an erosion or ulceration that has occurred as a result of the pessary rubbing on the vaginal tissue. So we want to be careful to pay attention to any complaints that the patient may have of spotting or bleeding. It should be noted, however, that I also found that when patients are straining with the bowel movement, which we're going to talk about next, they may experience a small amount of spotting at that point in time because of the straining, and that is not necessarily something you need to get concerned about. However, when you remove the pessary, you're going to take a moment to run your finger around the inside of the vaginal tissue and do a sweep to see if you can identify any bleeding that is evident. You will have noticed on the pessary when you removed it whether there was any evidence of bleeding on the pessary. And if there is evidence of bleeding, then you want to feel and see if you can feel any type of an erosion that you think may be present. It would be at this point that you may want to insert a small speculum to have a look to see if anything's going on. If in fact you do identify an erosion, then the pessary should remain out for a couple of weeks. And you may want to ensure that the patient is using some Premarin vaginal cream or Vagifem on a regular basis to help with the healing process. If there is no sign of an erosion, then it may be that the pessary has become too large and it would need to be resized, in which case, if you're able to provide a resizing within your own practice, that would be an option. Otherwise, a referral to a gynecologist may be necessary to ensure that the correct size of pessary is being utilized. Bowel dysfunction is another issue that we need to consider, primarily that of constipation. The pessary, depending on the type and style, does increase the pressure in the rectum and can contribute to the patient having to strain with a bowel movement. We don't want the patient to be straining with a bowel movement primarily because there's the potential for the pessary to come out of the vagina and would then need to be reinserted. We need to encourage the patients to ensure that they're drinking enough fluids and consuming enough fiber in their daily diet, and if they're not, to encourage them to increase that. Make sure that you ask them about their bowels and if they're moving regularly and if they're constipated, so that you can prevent that from occurring. One other strategy that can be effective if they have issues with constipation and do have to strain with a bowel movement, and that is to ensure that they put their finger in front of the vagina to hold the pessary back in the vagina while they're having a bowel movement, and that can be effective as well. Follow-up pessary care really depends on each individual patient, but usually every 2 to 3 months. It depends when you remove the pessary what condition the vaginal tissue is in. So if it's irritated, you may want to do it more often. If they're using a vaginal moisturizer and it's easy to remove the pessary and reinsert it, then probably you have the right amount of time that you're currently following. When the pessary becomes difficult or tight to remove, then often increasing it to a more frequent changes will help with that. One thing is very important to remember is that pessaries cannot be ignored, forgotten, or left in place. I encourage you to book the next pessary appointment before the patient leaves the office so that they have that in place, and to keep track of when they are due to come in. In conclusion, I hope this short video has been helpful to you, and that you're able to watch it as many times as needed to feel confident with doing your pessary care. You will also find that enclosed with the connection for this video was an information health sheet for each of your individualized patients that provides you with written instructions, primarily the same as what I've talked about in this video.